let's do a skin check. So I said the right apical. So you need to pull the shirt out of the way. Can you feel, my hands are freezing. Can you feel me touching you here? All right, and I don't see any redness, any abrasions, any open wounds. All right, so now I'm gonna check the apical. You need to know it's right here. So remember we did this early on, so it's gonna come back to haunt you. So what I'm gonna have you do is take 2 or 3 deep breaths in through your nose and out through your mouth. Good. Good. And how about one more? Good. Breathe normally. What should I hear? What's normal?
The ocean.
The ocean, right? If you had pneumonia, I'd probably hear crackles. Right? So the right apical, push that stool out of the way, Alex, and can you give me those 2 pillows, somebody? So you need to slouch, bring your butt forward in the chair. I bet you are. Yeah, I suspected, right? And here. So with a real patient, that's a safety hazard. You're not gonna have their feet on the stool. And make sure you don't treat them on a stool because that would be a safety issue. So you want to treat them on a chair, all right?
Are they supposed to have armrests in the chair?
Doesn't matter.
Doesn't matter?
I just give them a couple pillows, right? And you need to watch body mechanics. So depending on how tall you are, how short your patient is. So I could sit here. I'm not going to try to fit the, no, that's okay. I'm not going to try to fit it. Or I'll probably just do this a little bit. So you don't want to slap on the skin. A lot of students do this. It's not slapping someone like this. You need to cup. And I can probably use 2 hands on him. If you have someone tiny, just use a 1 hand like I showed in class, and it should almost sound like a horse galloping. And my right hand, because I'm right dominant, is way more coordinated than my left hand. It's just the way it is, all right? So it's going to be firm pressure, but if it's too much, you're going to need to tell me, okay? All right, and the way I'm positioned is that I want all the secretions, like I said in class, to come to the center so you can expel them. I don't want to stand like this and push the secretions down that way. All right, so I'm here. So ready, Alex? Okay. You all right with that?
Oh yeah, I just want to see what it looks like.
All right, 2 to 5 minutes. All right, and then what I want you to do is take a deep breath in, and on the way out, I'm going to vibrate a little bit. Let it out. Good. Deep breath, and let it out. Good. And deep breath, and let it out. And how many of those? 6 to 8, right? And excuse me, I'm going to grab this, all right? And so now the last thing I want you to do is something called a hough cough. So that's kind of when you fog up a mirror, right? So what I'd like you to do is try that now. A little bit harder. That's it, a couple more times. All right, sounds like you're not doing too well. Why are we doing a huff cough?
Get the mucus out.
To keep, what is it? It does get the mucus out, but it holds the airway open. And I'll tell a patient a lot of times when they start coughing, they actually create more spasm because they're doing these hard coughs. So this low volume cough will keep the airway open so that you can let the mucus out. And so what I want to do is I want to recheck the lungs after I do that to see if my treatment was effective. So can you take 2 or 3 deep breaths in again? Yeah. I don't know why you're bringing your neck into extension, but you are. And how about one more?
Using them accessory muscles to lift through.
He is using accessory muscles, I agree. And I would do a skin check. Can you feel me touching you? Yeah, and he's a little bit pink from where I just worked, but I mean, that should fade in a few minutes. The other thing I want to mention is usually what I do with the patient after I do my indications, contraindications, skin check, listen to the lungs. Usually I'll sit next to him, and before I actually do the treatment, like the percussion, vibration, and huff cough, I'll kind of show them on myself. If they have never had it before, because they may not understand how vigorous it actually is. So I'll do the percussion on my leg, and then I'll have them take a deep breath in, and I'll show them it's just a shaking sensation. So what we're looking for in the skill comp is that you also check in with them once you start your percussion. Is that okay? If it's too hard, let me know. but it's pretty vigorous, but there's gonna be some people in class who are gonna say it's too hard, or you need to, go a little bit lighter. So does that make sense? All right, so that's your apical, so, yes. So let's show your posterior lobe, the upper aspect of that. So what I'm gonna have you do is turn around so you can kind of get under the table, and you're gonna put the pillows on the table and lean forward, Alex, on the pillows. So this is the first one. These pictures are in your PowerPoint, but have them do it sitting, it's easier. And then the next one, do you see what this says? Do not straddle the chair. At the time, this was the only picture I can find. So if you have someone literally try to straddle a chair, you understand that's not good for their balance and it's unsafe. So if you actually had someone straddle the chair for your skill comp, that would be a fail.
You look cool
That's
though.
why it says do not straddle the chair. Okay. I think this is easy to remember because students mix up the apical position with this, the upper part of the lobe, the posterior aspect. But if you did apical here, if you thought this was apical, you have no access to those because they're probably going to be up against a chair. So having the patient lean forward will open up these lobes here. So say we're going to do his right side. Everything's going to be the same with what I just went over. It's just the actual where you're going to do the treatment on is different. So again, I position myself on the diagonal. Everything's going to the center, all right? I'm not here, I'm not here, so you have to make sure you position. And then we're just going to go through the treatment part, so if it's okay. Okay, ready? And you just do this for 2 to 5 minutes. So it almost sounds like if you cut correctly, almost like a horse galloping. Is that too much pressure? All right, deep breath in and let it out. Good, deep breath and let it out. Good, one more, deep breath and let it out. So I'd really do 6 to 8 of those. I usually put one hand over the other when I do it.
And this is the cupping?
Hmm?
What's this called, the cupping?
This is vibration.
Vibration.
This was the cupping.
With the
It
cupping.
sounds like a horse. This is a vibration. And then you would sit up and do that huff cough for me. Very dramatic, yeah.
Well, that's what's
Right.
how it said do
Yeah.
it, right?
So, but I want to hear, we want to hear, we want to hear why you're having him do a huff cough. I shouldn't have to ask you. So again, before you do it with the patient, sit down next to them, explain what the huff cough is about. It's supposed to keep the airway open, right? Okay, so make sure. So this skill comp, it's not difficult. There will eventually be a soap note. So we will finish up all the other positions tomorrow for this, and then we'll figure out what day you want your skill comp done by, because I know next Monday is your exam, so if we have to push it a little bit further into next week, we will, so you can get that in. When is your first neuro skill comp?
This week.
How many do you have there? Do you have 3 also in neuro?
No, it wasn't all 3 positions?
No.
Three skill comps?
How many skill comps?
Oh, okay.
We just have one right now.
2?
Total.
2 or 3?
So 2 or 3, okay.
Two, three, three, four.
This was one.
Yeah, because